Good morning, YouTube. Excuse me. I have some work to do. Really? Yes, really. This, hanging out like this for a long time, drives something called tech neck. My name is Dr. Renée Ostertag, and I have the privilege of spending much of my professional life with.
I'm Dr. Robin Gisbert.
My world is so much better with Dr. Robin in it because she helps me find circuits of playfulness in my role as a physical therapist in the world that specializes in how psychosocial aspects affect the physical body. Welcome, welcome, welcome. Today, Robin and I are going to be talking about tech neck and what you can do to fix it. So we're glad to see you here. Thanks for tuning in. Robin, tell me what you learned about tech neck.
Yeah, tech neck. And before we go on, Renée and I are both doctors of physical therapy. This is not medical advice. This is education. We want to share some things with you that we've learned both about tech neck and some ways out of tech neck, because who needs a pain in the neck? Not me. Neck pain, a leading cause of disability globally. It's the fourth leading cause of disability in the United States. I mean, a lot of us have neck pain. I mean, really raise your hand if you've experienced neck pain. Nothing to be ashamed of. Tech neck, this idea that we're into our devices and down, bowing down to the device, and the pressure that comes at the back of the neck from this experience. Many, many, many folks dealing with this.
Oh, this is an uncomfortable number, but the weight of the head when it is lined up with your microphone, the weight of the head here is about 12 pounds. Every 10 degrees down, it increases by a significant percent. And by the time your head gets here, the load on your cervical structures in your neck is about 70 pounds. So a 12-pound head can become 70. And you know this is true inherently, because I'm sure when you pick up something heavy, you hold it close to your body. You don't walk around with a heavy box out here. You bring it here because inherently your body knows things weigh less here. 12 pounds here is not 12 pounds out here. So welcome in. Hi, Paisley. Who else is here? And where are you from in the world? One of the things I love about YouTube is that I get to connect. Robin and I get to connect with people from around the world. Where are you? Do you use a screen? And how does it affect your neck? Oh, okay. Paisley, everybody else, see a number of people here live later. Thank you for being here. Tell a friend to tell two friends, because we believe we're doing good work in the world. And life can be really, really hard. So the best way through is to do this together. Ideally, in a nervous system of social engagement circuits, more often than fight, flight, freeze. Because when I'm in fight, flight, freeze, I don't want to connect and solve problems. I just want to get the heck out of Dodge. So that's why we're here together, is to connect to ourselves and one another and contribute to make the world a slightly better place, at least my world. I'm selfish that way. So, friends, let's talk tech neck.
Yeah.
Little bit of background. I worked at a orthopedic physical therapy clinic that specialized in the spine all day, every day for about 4 years. All I worked with was neck and back pain. And I learned a lot. We're going to show you one exercise today that has two parts to it. Two levels, really. A basic and a more advanced. Westerville, Ohio, Hazley, 40 years on a computer. Does your neck hurt? Is your head heavy? Do you find yourself hanging out like this often? Because you got a heavy head. So, spine clinic. I'm going to show you this exercise called neck retraction. Many of you know this. It's not rocket science. It's actually a very basic exercise, but please do not be fooled by its simplicity. When I would teach patients this exercise and they saw the effect of it on their range of motion, their function, lowering pain, it gave them a sense of agency. They learned how to use this exercise strategically. And when they would apply it in their life over the course of 2 to 3 weeks, 2 to 3 months, they were able to avoid neck fusion surgery. It's not a simple is not effective exercise. It's a simple, when applied right, very effective exercise. So some of you might have seen this. What we'll do today is do a little baseline measurement, do the exercise, and then reassess so you can see for yourself if this is an effective exercise. Many of you have seen this, heard this, chin tuck, neck retraction. Let's do a baseline measurement, and then we'll do the exercise. We'll start with the simple version, do a reassessment, then we'll go to the more advanced version. So join me and turn your head to the left. See how far it goes. Just notice what that feels like, how far you go. Where's that first place of restriction? Can you move past it or not? Where's the second place of restriction? Notice how far you can see. Come on back whenever you're ready. And we'll do the same thing from the other side to the other side. Go as far as you can. Just notice. Neck flexibility or lack thereof is not a character defect. It's simply a data point. So don't beat yourself up if things are stiffer and hurt more than you like. It's just data. Now, go ahead and tilt your head to the side. Check your lateral flexion right to left. Oh, same thing. Notice where that place of restriction is, how far you go. Ugh, this one's funky for me today. Go ahead and look up. Keep your mouth closed. Sorry for looking up my nose. Come on back and look down. And just get that baseline data. Now, neck retraction. I'm going to actually give you a little more of a view of my neck. This is a subtle thing. It's not a chin tuck. It's an imagination. Somebody that has really bad breath wants to kiss you. It's terrible. What do you want to do? Move away from it. Oh, God. Okay, so just slow it down and really notice what this feels like. You want to imagine keeping your eye level gaze straight in front of you, and you're just pulling your head straight backwards. Return it over the shoulder. You're doing two things here. You're restoring lower cervical extension, which is the opposite of flexion, right? When you're in that tech neck position, you're reversing it. And you're also opening up the base of the back of your head, right? Because when we slouch forward here, we tend to tip that back. So you're reversing two things. You're changing the position of your lower cervical spine and you're opening up the upper cervical. So if you have any headaches or things, symptoms that go into your head, face, ears, this is a corrective posture for that. So that's part one, is just retract your head. And notice it might feel stiff. It might feel uncomfortable. It might feel weird and awkward. It's definitely a sexy look when you give yourself 2 or 3 chins. So sexy. Okay, so you're retracting your head. That's part one. So you retract. Now, what I invite you to do is retract your head. And now from here, make sure you're as relaxed as you can in this awkward edge. You want to find your edge. And from here, you do a physiological sigh. And then you relax. So this is the second part.
Mhm.
Good morning, Michelle. It's great to see you and everybody here. So you retract the head, bring it back subtle. Notice that place of resistance. So you're hanging out the edge. And here, 2 inhales. And then exhale. And then come out of the retraction. Ugh. Let's do one more together and then we'll get some feedback. Welcome, everybody. Retract your head. Go to that place of your barrier, wherever that is. Find the edge. Hang out at the edge. Respect it. Don't blow past it. Just hang out here. See if you can do a physiological sigh in this edgy position of retraction. Oh. Oh. And then you relax out of retraction. Now, I'm curious to hear feedback, and then I have some other thoughts to share. Let's reassess range of motion. Just go ahead and turn your head. Notice the difference now versus earlier. I'm pleased with what I found there. It was just easier to get to the same place. I didn't pick up any range, but it was easier. Same thing here. Much better quality. Go ahead and test your lateral flexion. Wow. Something opened up in me on that one. Here. I didn't have that same heaviness wall moving against, fighting against myself. And go ahead and look up. For me, everything feels more relaxed, more available, and there's less of a fight to turn my head. That's what I noticed. What did you notice? Type it in the chat. Type it in the comments. Robin, tell us your experience.
Yeah, really nice. Yeah, just more ease of movement into all of these directions, and maybe a little more movement. Freedom, lightness. Renée, it was fascinating to me to be listening, and the difference in your voice here with this kind of tech neck position, and how that even, it's a pain in the neck, but it's closing down the breath a little. It makes it more difficult to swallow. And up in this position, just the better resonance and the better breath. So gosh, this exercise it's good for your neck. It's good for your breath. It's good for so many things.
Watching you also makes me think of the biomechanical properties of the vagus nerve and the autonomic nervous system. You know, nerves are in a way like ropes. And when we're aligned, there's some I don't know if this is going to work, but let's try it. There's some it's an open pipe here, right? When we go into this position here, it kinks the pipe, and it sort of, this isn't going to work great, but the idea is that it kind of puts tension on the physical structure of the nerve, and it compresses it. Think about a hose. You step on it, the flowers aren't getting water. And when the flowers don't get water, they die. And that looks like for you, I'm not saying you're going to die, but when the head is in this position, it can obstruct the function of the autonomic nervous system, the vagus nerve, the cranial nerves that all come out of this area. And that can show up downstream like gut-brain disorders, migraine headache, irritable bowel, autoimmune, all those yucky, gross conditions that stick around for a long time. And we supplement and medicate and inject and operate, and we've not unkinked the hose. And what I love about the advanced version, bringing in the physiological sigh to the retraction, is it's a way to not only unkink the hose, but get water moving through it again. It brings life force energy. Your breath, your blood is life force energy. And I love that we have the agency. We have a say, right? When we go into seated postures, it can induce this sense of physiological helplessness. You can change all of that. We got comments coming through. Let's just say, let's hear.
I love the agency. Hi, Charity. Thanks for bringing a friend. Kayla, welcome. Brian had some good results with this in just a short amount of time.
Okay, cool. We see lower back and rib ache feeling better. Neck range, both sides, has improved. Carpal tunnel suppression is also relieved. Paisley, this idea of a double crush syndrome, right? If you're always, in a funky wrist position, ideal wrist, most open pipe is here. When you go here or go here, it's not bad or wrong. The system's designed to be able to kink and torsion twist. It's when we go there and stay there, and then we're here. You've crushed, theoretically compressed, irritated, created a space 2 times now for the nerve to have less than optimal blood flow. And the only way it can tell you there's a problem is by pain. Your body doesn't want to be hurting. It doesn't want to betray you and create all these problems. It's trying to communicate a signal to you that would be helpful to know. I wish bodies could text messages. That would be a hell of a lot easier than trying to discern what the heck pain is saying. Who else has thoughts about this? I had another thought on Paisley's idea. Her thing wasn't so much hanging out here for a long time. It was hanging out here for a long time. You have a monitor off to the side and you're in this position for a long time. Same thing. The system's designed to be able to do this, but is it supposed to go there and stay there and not get blood flow? Your poor little internal flowers are just drying out because they're not getting water because your kink neck hose. English. That's what I speak, I swear. So what I would recommend for that is, instead of retraction, maybe go to the other side and find your edge, right? So if you're sitting in a restaurant talking to people for a long time, if you have a screen to one side for a long time, the way to correct for that is go to the other side, find the edge, and do a physiological sigh here.
That's good. Charity's asking a lovely question. And yeah, the more open this position of our neck, yes, the nerves have a better pathway and a healthier pathway from brain to body and from brain and neck out to the body. And your blood flow has a more open passage. And yeah, we need that open blood flow to the brain to deliver oxygen. So this is just really a win-win-win exercise when we get the chin tuck happening.
Robin, did you just speak to Charity's comment?
I did, yeah.
I was trying to track all that, but there was just too much input happening at the same time, which leads me to this thing I learned recently. 700 years ago, an adult had as much learning input in their lifetime as we have today in a single day. We are all inundated with information. And so the natural response is to kind of protect and go down. This is just a really helpful reminder of how to find and feel safety again. Did you have something to share, Robin?
No.
Okay. Any other questions? We like supporting. We like creating space for conversation and empowerment, confusion between mind and body. What's on your mind? What do you want to hear about? Paisley was sitting cross-legged on her chair and it telegraphed through the whole body. Yeah, what you do in one affects the other. I still remember a video where my neuro instructor had harvested an entire nervous system from a cadaver. So sorry if you're squeamish, but in her lab, they were able to take out an entire nervous system. And she showed us a video where they just pulled a little bit on one of the nerves down in the foot, and you could see the brain move. It's this biomechanical effect. You pull here and it tugs up at the top. So what you're doing down in your lower extremities and in your pelvis and hips, it affects the ability of the brain to move up and down smoothly in its container.
Charity, thanks for that share and these deep sighs, any access to that parasympathetic nervous system. What a positive trajectory and intention to bring that on board.
Charity, how does hypermobility affect the neck? Do you want to speak to that or both?
I think it's a new series.
I guess go ahead.
Yeah, and this exercise, this chin tuck for these deep neck flexors, strengthening the hypermobility in the neck. We want to have good structural stability, so when we move, all the bones are moving in their alignment and protecting that blood flow, protecting the nerves, protecting all the tissues around the cervical spine. So we see when people have hypermobility, they might be more likely to have some aches and pains in the necks and at other places of the body. And one approach to that is this very exercise. Not only does it improve the position and the breath, it can help strengthen these muscles that protect the spine.
When I think about hypermobility in the neck, I think about the range of being human. Some people come in very mobile and flexible and they become Cirque du Soleil gymnasts. Some people come in really, with a whole lot less mobility, maybe more, power lifter type of bodies. The whole range is the range, and I think none of it is pathological. Everybody just has what they have, and they get to learn how to manage it well, as best as they can. When there's hypermobility, I get a little about that term because it can, for some people, suggest pathology. Something's wrong with me. I'm moving too much. And I would like to say to you, you are just made in the perfect image and likeness of God. Whatever that means to you, one word I have for you, it's perfect. Now, if you move more, great. You get to learn how to be responsible for that movement and have, like Robin was talking about, the ability to feel safe in all of your positions. So maybe Pilates would be good, deep stabilizers, to have the stability to control that more mobility you have. And the people on the other side of the spectrum that are hypomobile, they have a different set of challenges that they get to learn. They get to spend their time stretching while you're stabilizing. So that's what I would say about hypermobility in the neck. All right, friends. Thank you for bringing your friends. Keep telling your friends to bring 2 friends. I think we have 4 more in this next series. So for the next month, that's what we're going to be talking about on Wednesdays. And remember, you have agency. You can learn how to control your body. And the more you have that, the more control you have in your life. Paisley, thank you. Charity, thank you. Everybody, Kyla, Brian, Michelle, it was great to see you here today. Thank you so much.
Until next time.
Bye. Don't know where you're going, but you can't stay here. I think I hit the right button. No, it's not doing anything. So we're just going to keep hanging out. maybe you'll come into a little more retracted position. I don't know why it's not ending.